So what will the federal government's plan to fight this disease look like? Joining us now to talk about the Advisory Council's recommendations is Assistant Secretary for Health at the U.S. Department of Health and Human Services, Dr. Howard Koh. Welcome, Dr. Koh.
Thank you, Lark.
Well, let's talk about this welcome announcement from Secretary Sebelius that happened in February. More funding. Obviously, many of the experts are calling for a lot more, but how do you want the millions of people living with Alzheimer's to view at least this initial additional funding?
Well, we're very pleased that right now we have a draft action plan for the country for the first time to really galvanize all the forces around the country to tackling this tremendous public health challenge. And the Secretary's announcement now adds another $156 million of funds for research and outreach and education to really tackle this condition as a country for the first time.
All right, let's break down some of those numbers. You can do $50 million right now and for research, $26 million for caregivers. What do you want to happen with that additional $50 million for research?
Well, we have as an overall goal for this plan to have by the year 2025 effective treatments and prevention of Alzheimer's disease. So that's a goal that we discussed, but it's one that offers great hope for the country. So we want this additional money to advance research and effective treatments for patients. And then we also want to tackle many other pillars of this plan to support patients, to support providers who are under tremendous stress, and also advance education because there's still too much stigma about this condition.
Who will be helped immediately by this $26 million in caregiver money?
Well, patients and caregivers should be helped almost immediately. And we understand, as you've seen on this clip that you just played, that this is a condition that's devastating, not just for our patients, but also for caregivers. And they are under tremendous stresses, not just financially, but also physically and emotionally. So we want to support the patient, we want to support the caregiver, and we want all of society engaged to advance this plan and really make a difference.
All right, let's talk about what many see as this huge funding gap. When you look at the numbers, even with this new money, Dr. Koh, you're still well under $1 billion when many other diseases are getting more than $1 billion. There were decades ago when we had the war on cancer, the war on HIV/AIDS, where they got more funding then than is being allocated for Alzheimer's and dementia research right now. What do you say?
Well, first of all, having a plan really galvanizes attention to the money that we do have, about $500 million in the system already, and make sure that that money is being well spent. Then we also use the plan to stimulate public-private partnerships to raise even more resources in the future. And then the Secretary's announcement of this additional $156 million over the next 2 years is a great start. We hope that this is just the beginning of resources from all parts of society to really tackle this condition.
Let's listen to one of the Advisory Council members. He's from New York, and he says he'd like to see a robust dementia care system. This is David Hoffman from the New York State Department of Health.
We suggest providing federal funds to support a state lead agency in every state. And we indicate that one potential source of those funds would be the additional $250 million in mandatory funding from the Affordable Care Act that's part of the Prevention Public Health Fund.
All right, what about that proposal?
Well, we have many states that have tackled Alzheimer's and have state plans, so we commend those states, and we want this national strategy to stimulate the other states to get on board as well. So there are great opportunities right now, Lark, and we want to take advantage of all of them through this plan.
All right, let's talk about Medicare and this whole issue of what some people call a mismatch. You saw Kathleen Lockhart say, my husband needs custodial care. It's not considered medical. First of all, do you agree there is a mismatch between what Medicare pays for and what's needed in people's homes and people's everyday lives?
One of the great promises of the Affordable Care Act is that we want to take this opportunity, again, to stress better care coordination for patients like those with Alzheimer's, put the patient back in the center. And so that's what the Patient-Centered Medical Homes movement is, that's sponsored by the Affordable Care Act, these new accountable care organizations that have been put forward by the Affordable Care Act. And we are looking at new models of caring for people, and that's why this Alzheimer's plan is so important.
I know you have expressed, frustration, at times in your job with trying to move things forward in this public health sector. Have you ever been ashamed when you looked at the funding disparities? What emotions, what words do you put on when you look at where you'd like to be?
Well, I'm a physician, Lark, and I've cared for patients for over 30 years, including many patients with Alzheimer's. And what motivated me to get into the public sector is that the status quo is simply unacceptable in so many areas. particularly in areas like Alzheimer's. So this is an opportunity now, if we work together as a nation, bring in all the sectors and parts of society who care so desperately about this issue, we can make a difference, and I think we're starting now.
Thank you so much for coming in, Dr. Howard Koh,
Thank you, Les.
Assistant Secretary for Health at the U.S. Department of Health and Human Services.
Thank you
We
very much.
appreciate it.
Thank you.